I like to share with you these testimonies of all these patients who had COVID, and lots and lots, hundreds of patients had COVID, and they came rushing to look for the oxygen drops, and pretty much everyone is still alive. And of course, they believe that oxygen drops help them to boost their immune system and to stay alive, and they will tell you their testimony. There are a few of them in English. This is Stephanie, and about probably 3 or 4 weeks ago, she came and she totally believed that she had COVID. Her lungs was terrible, and her husband had it and the child, and she was sure. She went to 2 emergency room and they would not even test the COVID. So I gave her the oxygen drops, and I let her tell you how bad she was, how she was feeling, and what happened with the drops that I gave her.
Okay, so I was very sick. I'd never been that sick before. I had constant pain in my lungs. It hurt everywhere to breathe, to talk. Breathing was just a chore. It was the worst thing. And like I said, I can't remember ever feeling that sick ever. And I've been sick a lot. But came in to see Dr. Simonette. I had taken a couple different antibiotics. Didn't change anything, and he gave me some of his oxygen drops. We started with a certain dose, and then we changed that, and the second time around when I started taking the drops
At a higher dose.
It was amazing how quickly it changed everything. I started having less pain, my breathing got a little bit better, and there was such a quick turnaround between what the doctors had given me with the antibiotics that got me nowhere to when I took the oxygen that Dr. Simonette gave me. And I feel like that was what helped me get better. I don't even think, maybe I might not even be here, but the last emergency room I was in, they were fairly certain, they left me with the idea, they were fairly certain that I had it. So yeah. They just explained they couldn't do the testing right now because other people were a priority, and I was just supposed to go home and, quarantine and wait for whatever was going to happen.
Yes. Thank you very much, Stephanie.
You're very welcome.
This is Sandy, and she was just telling me that she and her family had COVID, and her husband, and that his oxygen level was low, and that her mother gave her some of the oxygen drops, and she will tell you now what happened.
My mother is a patient for Dr. Simonette. She brought upon my attention the drops that he has here at his facility. He took them. My husband's oxygen was about 88. My doctor said, you need to rush him out to the hospital. I started giving him the oxygen drops, and it was just so rapidly, 2 to 3 days, he went from an 88 to a 92, 93, which avoided me from taking him to the ER. Those drops have helped my husband, my family, and I to actually overcome the COVID without any more complications. It's great. It's great for us. It was amazing for us.
All right, thank you.
Oh, okay. My son Alan had COVID. He was seeing a doctor, and he was bed-stricken. Hasn't eaten 4 days. Hasn't had appetite. Hasn't no taste buds, no smelling. He was listless, and he was in bed with his girlfriend. And I gave me a sample of 75 drops of the oxygen drops, and I took it to him because Dr. Simonette prescribed it to me. I gave it to me for just to have, and I gave it to my son, and I gave it to him at 8 o'clock, and he accidentally just drank it straight, and he goes, "Oh, Dad, that was horrible. That was very horrible." He goes, "You're supposed to dilute it." It was a little container with 70 drops. He said, send me off on my way because he didn't want to contaminate me with COVID. So he thought he was going to go right back to bed. And his girlfriend was in bed, and he sat on his bed and watched TV, and he started watching television, and they started showing food. And so he got up fixed dinner. Fixed, a late meal, and he ate. He asked his girlfriend. She goes, no. She still was, feeling her symptoms, but he said within about 4 hours he felt great. He wanted to eat. He cooked a real nice meal, and he offered his girlfriend. But within 2 days, she was hospitalized. Within the morning, he called me, told me that he's out in the yard, and he feels great. He's cured. He feels he's cured. And he says, I think I'm going to mow the lawn. That's how amazing. And I seen him. He was pálido. He was sucked in. He was, oh man, I was so worried. He definitely had COVID. Doctors told him, his fever, his loss of sense, and his loss of appetite. That was all the symptoms, and they weren't really doing nothing for him, But
And so 2 days later, he was back to
no,
work.
the next morning.
But 2 days after that, he was back to work.
Oh yeah,
basically.
2 days later, he went back to work.
Yeah.
They're doctors he works at Amazon, and they have a clinic there, and they said, no, you're fine. He goes, he didn't tell them that he was down and out that bad. They just sent him home from work, and he didn't tell them that he went through a lot of misery. But he wanted his job back. He was bored as hell from laying in bed for over a week.
Mm-hmm.
So 2 days later, after he he consumed the oxygen bubbles, he was back at work.
Yeah.
And he hasn't turned back yet.
Yeah. So he knows that the oxygen was the one that totally.
Oh yeah. He called me the next morning. He says, Dad, I'm cured.
Yeah.
He says, I seen him that night, and I just never seen somebody. I thought he should be in the hospital the way he looked.
Mm-hmm.
Well, his girlfriend ended up going to the hospital.
Mm-hmm.
She was hospitalized for a couple of weeks.
Yeah.
Mm-hmm.
Yeah. And this is Alan Reyes, and I know the family. They've been my patients since the 90s, and I know the kids from they were small, and now they're grown.
That's gospel truth,
Yeah.
Yeah. And I was so grateful. Thank you.
Yeah. And you.
Otherwise, he might have suffered more. I might have lost him.
Yeah. Mm-hmm. Okay. Thank you, Alan.
You're welcome.
This is Brian, and about 3 months ago, he came and he was having headache, body ache, fever, runny nose, and his wife was here in the room with him doing the same, and she was coughing, and she told me that he had COVID and had passed it on to her. So I went and got him a cup of water, warm water with 20 drops, and I had him gargle, and he will tell you what happened after that.
The very first day, I experienced everything that COVID would have came with: loss of smell, loss of taste, body aches. I took 2 days. I came to Dr. Seminat, and he told us that he would give us some drops, oxygen drops, and if you take 30 of them a day for the next week, and if you guys test, well, one of us will test, will be my girlfriend, and if she comes back positive, of course I'll have it because COVID's contagious like that, and we're sleeping in the same bed. Well, that week came along and I was perfectly fine. I didn't experience no loss of taste. I was able to smell again. No body aches, nothing at all. And also, once my girlfriend got positive, we also started doing it to her. And the next week after that, it cleared.
So your girlfriend, your
And
wife,
she was pregnant.
Yeah, was pregnant, and so she got over it by doing the oxygen drop, and I believe that the day after you came here, you also was free of symptoms.
Yes.
I remember that you told me. So yeah, the oxygen drops, you believe is what helped you.
That was the only thing I was taking.
Yeah.
Oxygen drops.
All right, thank you.